Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today we will meet Dr. Pilar Johnson, who's a new physician at Novant Health Oceanside Family Medicine in Southport. Then we'll speak with Amy Myers, Director of Marketing and the Foundation at Novant Health Brunswick Medical Center, and we'll learn more about what the Foundation is doing in the hospital and in the community. Finally, we'll talk with Dr. Thomas Kelso about the orthopedic specialists and their services here in Brunswick County. Stay tuned to learn about valuable health topics with HealthWatch. Our first guest today is Dr. Pilar Johnson, a new physician at Novant Health Oceanside Family Medicine in Southport. Well, welcome to the show today, Dr. Johnson.
Thank you very much for having me.
Well, it's a pleasure to have you, and I understand that you just recently moved to the area. Is that correct?
I did.
Where did you practice before coming to Novant?
I did my residency in Maine, so I lived there for the last 3 years and just moved back and started with Novant August 1st.
That's great. Well, I'm curious, what brought you to the area?
Well, I'm originally from North Carolina.
You are?
I am. I was born and raised in Durham, and then I went to college at UNCW and lived in Wilmington for several years before I went to medical school. So really, Wilmington is more home for me now. My parents live in Brunswick County. They live in Sunset Beach. So,
oh, that's awesome.
So this was really just coming back home. It was way too cold for me.
I was going to ask about that. How do you? Maine's pretty cold, isn't it?
It's beautiful, but very cold and long winters.
Yes.
So it was time to come home.
Yeah, that's great. The weather here is awesome. So you briefly touched on your education and your background.
Yes.
Tell me a little bit more about that, where you went to school. And I understand you were in the military, or are in the military.
Yep. So I went to UNCW for college, and I stayed in Wilmington after college. I didn't want to leave the beach, and I was working for UPS at the time.
No way.
Yep. So I stayed there for 11 years, and when I was in my early 30s, I left that job and went back to school to do a few undergrad courses before applying to medical school. Ended up in medical school in the Caribbean, so I lived in St. Martin for a couple of years.
Oh, that's such a chore.
Tough life. And then I did the majority of my rotations for medical school in New York State, so I lived on Long Island for a couple of years, and then residency in Maine. So that's sort of the short end of it.
I'm curious, how do you go from UPS to medical school? What was your driving factor there?
Well, medicine has always been something I was interested in. I have a lot of friends in the field. I don't think, as a kid, I didn't know that I wanted to be a doctor. I wasn't sure what I wanted to do, but it was certainly something I always had an interest in. And when I was working, I did a master's in business as well, and I thought, well, if I can get through that doing something I really don't like, then I should be able to swing medical school. So really, it was more of a decision I made around my 30th birthday. I wasn't doing what I had intended on doing with my life, and so I made that jump. So
that's very interesting. We have another physician in the area who worked in the U.S. Postal Service.
I have met him. Yes.
I think that's very interesting. You two have some things in common.
Yes.
Well, now I touched briefly on the fact that you are in the military.
Right.
Tell me about that.
Yeah. So I'm in the Army Reserve Medical Corps, and I started doing that when I started residency. So I've been in for about 3 years, just as a reservist. So.
And so I don't quite understand that. You're in the reserve for a number of years?
Yes. Yes, I will be in for at least 8 years.
I see.
And maybe longer. We'll see. See how it goes. But
and hopefully you won't ever be deployed.
Well, hopefully not. But you
never know.
You never know what might happen.
I think that's a very interesting situation. I don't know much about the Army Reserves, but it's fascinating, I think, the military in general and how that works. So. Well, that's great, great information. And I want to know more about the practice in Southport. Now, I know that you've joined Dr. Moore's practice,
Yes.
which is Oceanside Family Medicine,
In
Southport, correct?
Yes.
So where is the office actually located?
The office is on Howe Street. It's near the intersection where River Road comes into Howe Street, sort of across from Walgreens.
Oh, that's convenient.
Yeah, it's very convenient for most people. So, and now we have a third person that's on, Dr. Asbury, who's with us part-time. So it's a very interesting patient population. Currently, since I started, we're now seeing newborns through all ages and trying to focus more on women's health as well. When Dr. Moore first arrived in the office, he had a patient population that had been in that office prior to him getting there. So he's basically worked with that patient population, and now we're getting a lot more new patients in, and we're trying to open up the demographic to expand pretty much the whole age range, trying to see more children and infants as well as young adults.
Does Dr. Asbury see children also?
She does. Yes, she sees babies up through. So we try and do full scope family medicine, with the exception of OB care. We don't do that in our office.
But so if women's health, women's checkups yearly, you'll do those? You do pap smears and things like that?
Yes, we do pap smears. We do various forms of birth control, Nexplanon, Implanon, IUDs. So any number of those types of things we can do in the office. We can remove IUDs.
Really?
Yep.
Wow, so, that's great.
Sure.
Well, that's kind of a one-stop shop then. You can have your child seen, and you can have your women's care done also. And that's something new in the Southport area, I believe, for a family practice.
Yes, I believe it is. That's my understanding, is that there are not a lot of, I think there maybe are some pediatricians in the area, but not family medicine people that are seeing children as well. So
that's really good for that area. That is a growing area, and so it does help to bring that service to the community. Are you currently accepting new patients then, all three of you?
Yes, because we have the two additional providers now. We have a lot of more time slots open up, and we're able to see more same-day patients as well, which has been helpful.
Oh, so you are able to see, if I called in the morning and I wasn't feeling well, I could be seen that day.
Absolutely.
Most likely.
Yes, it may not be by your primary care person,
of course,
but there's three of us to choose from now, so it's opened that up quite a bit.
Wow, that's great. I really like that. I'm curious, though, do you have any special interests that you want to talk about today?
Not particularly. Like I said earlier, we're trying to really get in a lot of newborns and children and young adults, and do a lot of women's health, which will be a nice sort of addition to what's already there. So that's really where we're putting some energy right this moment. Well,
I think that's real interesting. I mean, you may go from one room and see a 6-month-old, and you go to the next room and you have an 89-year-old person. And so it really changes up your day. And,
it's never boring.
No,
never
I
boring.
imagine it isn't, because but it seems difficult for me, but for you, it just seems so natural.
Well, that's family medicine. That's what it was supposed to be.
Yeah.
So
the whole family.
The whole family, exactly. And
Mom,
some
Dad,
people
Grandma,
are not,
Grandpa.
Right, and some people aren't used to that. You know, I've had a couple of patients ask me about that. You know, how are you able to take care of me as an aging menopausal female when you see babies and children? And I said, well, if you really want to mix it up, I can also deliver babies. I don't, but I can.
You can.
So yeah, it's an interesting thing, and that's part of the draw to family medicine for most of us, is that we get to do a little bit of everything. So.
Well, before we close, tell our viewers how they can schedule an appointment with you.
Okay, they can call 910-454-4032 and speak to anybody that answers the phone there, but it's usually Colleen or Heather, and they will get sent a new patient packet to fill out, so we can get a little bit of demographic information from them and try and get their records first. But
great,
we are open.
Well, wonderful. Thank you so much for being here today. It's been a pleasure. And I
you
hope
for
you'll
having
come
me.
back after you have been here a few months and tell us how it's going.
Okay, thank you very much for having me.
Thank you. Our next guest is Amy Myers, Director of the Foundation and Marketing at Novant Health Brunswick Medical Center. Amy, it's good to have you back on the show today.
It's good to be here. Thanks for having me.
You're welcome. Now, for our viewers out there who may not have met you yet, tell us a little bit about what you do at Novant Health Brunswick Medical Center.
Sure. Well, I've been in the area and with the hospital for about 8 years now, which is hard to believe. And primarily, I've worked in the marketing and communications field, but I've also worked with our foundation as well.
Well, tell me a little bit about your background and your education and how you got to be where you are today.
Actually, my background is in journalism. I went to UNC Chapel Hill, and I was a major in journalism. And wanted to write, wanted to be in the communications field, and ended up working for a cancer center, and really kind of fell in love with healthcare and working with people in that way, working with nurses and doctors, and kind of followed that path. And started at a hospital right out of college, and have been in hospitals since. So I just really, really enjoy the healthcare field.
Well, it is. It's so interesting, and there are new things happening every day in healthcare. So I can see why that interested you.
Yeah, and I think no matter your role in healthcare as well, you have the ability to touch lives, and that's a special thing to be able to do that on a regular basis.
Yeah, I agree. Well, we specifically today wanted to talk about the foundation, and I know there's a lot to the foundation, so I guess we just start at the beginning and tell me how it got started at Brunswick Medical Center.
Sure. Well, I'm glad that you wanted to talk about the foundation today. I think, while we've been on the show to talk about events we're doing and things like that, I think to some degree the Novant Health Foundation, Brunswick Medical Center, is almost our best kept secret. We're still getting out into the community, still teaching people about what we're doing. It started in January of 2011 is when the foundation was incorporated. So Novant Health had been in Brunswick County for several years, but we were gearing up to move into the new hospital, and as a not-for-profit organization, we felt it was the right time to establish the foundation as the fundraising arm of the hospital. So in January of 2011, we incorporated with our first board of directors, and that was a really exciting time.
Well, tell me a little bit more about the board of directors or the board members that serve the foundation. Are they employed by the hospital, or how does that work?
That's a great question. Primarily, they are not employed by the hospital. The board is primarily made up of community members, several prominent leaders in the community, physicians. We have a nurse representative. Our president of the hospital, Shelburne Stevens, he does serve as a foundation board member, so he would be really the one employed, but he kind of serves as that liaison between the foundation, which is really kind of the community, to the hospital. So Shelburne's able to bring details about new services and needs at the hospital and healthcare needs in the community to the group.
Well, Amy, let's talk a little bit more about the specific programs that are funded by the foundation. And I know that we've, in the past, talked about the Women and Children's event or the outreach program. So let's talk about what the foundation has done up until this point.
Sure. I'm glad you asked that, because I think that's the best kept secret that we're talking about. People, maybe heard of the foundation, heard of some of the events we've done, but I get the question a lot of what are we actually doing out in the community?
Where does that money go?
Yeah. Our mission is really to go beyond the walls of the hospital to improve health in our community. And we've been able to do that through our Women's and Children's Wellness Outreach. That's when the program programs you mentioned. And what we've done there is focus on smoking cessation for pregnant women, because in Brunswick County we had a higher than average rate of pregnant women who were smoking. We've already seen some improvements there. And then we focused on breastfeeding as well. Breastfeeding is tied to so many good outcomes for babies. So when it is possible, we really encourage moms to learn more about breastfeeding, and we're actually in the process of hiring a lactation consultant now.
Oh, that's awesome.
Isn't it? We're so excited.
Great.
And that was made possible by, the generous donations from businesses and individuals in our community have helped to be able to bring that program on and bring that service to women in Brunswick County. The third component of that program is childhood obesity, and that's really the one we're kind of moving into now. There's some ties between the breastfeeding and smoking cessation, certainly to help start off healthy. Now we're focusing on, as the child gets a little older, how do we help keep them healthy and not obese throughout life. So we're excited to really launch into that one in the next year or so.
That's great.
Yeah.
I wasn't aware of all those things that have been accomplished already in such a short time, really.
Yeah, there really has been a lot going on. In addition to that, just this year, we've been able to bring a mobile mammography coach to Brunswick County. And what we're doing is we're able to go, we have it 3 times a month, so 3 days, and we're able to go out in the community and give women mammograms in a place that's convenient for them. And as big as this county is,
right, it is big.
Transportation is a big issue in our underserved communities. So just in the very first week here, we were able to go to the New Hope Clinic, and really, some women who never had mammograms before were able to take advantage. So that's just been really great. And we're able to also offer funding to help pay for a mammogram if a woman does not have the resources to help pay. And that again, is all possible through those donations. So the foundation is doing some pretty remarkable things in the community.
So if somebody needs a mammogram and they're unable to pay, there are funds available provided by the foundation to fund that mammogram.
That's right.
Because I think there are a lot of women out there who haven't had the opportunity, whether it be they're just unable to get there, they don't have the transportation, or they can't afford, or both.
Yep, exactly. And that's what we hope to do, is remove some of those barriers. Let's remove the barrier around transportation. We'll bring the service to you. Let's remove the barrier around finances. We'll help pay if that's the issue. So we're really trying to remove barriers in the community to improving health. We've also got a prescription assistance fund. So one of the biggest problems on the hospital side is we have patients who they need a particular medication when they leave the hospital. And of course, you and I, we go to CVS or Thomas Drug. We go to one of the local drugstores. We get our prescription. That for some people, that's not something they can afford or easy to do. And unfortunately, what we were finding is they just didn't do it. And if they don't get those follow-up medications, they often don't get well. So our prescription assistance, lots of parameters around it, but it's to help people who can't afford those prescriptions when they leave the hospital. So we have to be particular about how it's used, but we're really finding that's going to be something that's very beneficial as well.
I did want to ask you one question about the mammography coach. Is there a way for viewers to find out where and when the coach might be available?
There is. You can actually call our radiology scheduling number. It's 910-721-1485, and they should be able to tell you where it's going to be. As I said, it's only 3 days a month.
Right.
But they'll be able to give you a schedule of where it's going to be, and if that's not convenient, we'll also talk to you about scheduling at the hospital as well. And that same financial assistance is available at the hospital too.
Oh, so whether it's in the mobile unit or at the hospital, those funds are available.
That's right.
Oh, that's awesome. That's awesome. Well, Amy, if viewers out there would like more information about the foundation, where might they find that?
The best place to go might be to start with the website. It's novanthealth.org/giveback, and you can get lots of information about the foundation there. Or, of course, you can always give us a call, and you can call 910-721-1473, and we'll be happy to provide more information about the foundation.
Great. Well, thank you so much for being on the show today, Amy. It was a pleasure. I've learned a lot about the foundation, and I'm sure there are folks out there who might be interested in being on that board or learning more about how they can help. So if they call 721-1473,
That's right.
they can get that information, correct?
That's right. That's
Okay.
perfect. Thank you.
Thank you. Our last guest is Dr. Thomas Kelso of Orthopaedic Specialists. Welcome back to the show today, Dr. Kelso. It's a pleasure to have you.
June, it's great to be back.
Well, it's been a long time since we've seen you.
Gosh, it's been 3.5, 4 years.
I know, it's been a very long time. So let's start off by telling our viewers again a little bit about your education and your background and where you've come from.
Sure, I'd love to. A lot of new people in the area that
That's right.
don't know me yet, and
That's right.
I'm glad to give them some background. I went to University of Maryland Medical School. My undergraduate degree was from Virginia Tech. Actually had a little bit of a detour. I got a PhD in physiology prior to going to medical school. So I did some academic research in physiology at Washington State and Penn State universities. Finished my degree in '87, my PhD, defended my dissertation, and then went to University of Maryland and went to medical school up in Baltimore at University of Maryland and finished there in 1991. After that, I owed some payback time to the military because they paid, I was on an Armed Forces professional scholarship to go to medical school. And so I ended up going into practice with the U.S. Navy and was on active duty for 9 years with the Navy. After that,
And then.
So, I mean, at that point I was, orthopedic surgeon and practicing. The last 2 years while I was in the Navy, I had a great time when I was with the Navy. I was the orthopedic surgeon for the Special Forces Group, the SEAL Team 6.
Wow.
We used to call that Naval, or the Special Forces Development Group, or the DEV Group, which was the official name for SEAL Team 6, which are, the elite guys there.
The elite.
So I was with them for 2 years. I never deployed or went to battle with them, but I was always there when they came back. And they were interesting guys, a lot of interesting injuries, either from training or from combat missions, and those were some good times. But I got out of the Navy in 2000 and took a job in private practice in the Midwest and stayed there for 10 years. My wife decided she was tired of the Midwest.
My wife decided.
Our kids graduated
Sure.
from college, high school and college, and then at that point she wanted to get back to the Mid-Atlantic region where she grew up, and we have a lot of family on the East Coast. And so 4 years ago we moved back and started practicing here.
Wow. At first my initial thought was you couldn't decide what you wanted to do when you grew up.
It's true.
So you just kept
That is true. Fortunately, I kept making good decisions, though.
You did, yeah.
And I thought I was going to be a college, professor
Really?
and do research at first, and then I did a lot of work with some very good clinicians who happened to work in the veterinary medicine world, and they kind of got me interested in doing clinical medicine and taking care of patients. And at that point, I said, well, I'm going to take the medical school admissions test, and if I get in, I'm going to take it as a sign I need to do it. And
That's
so,
right.
That was
Unfortunately for us, you ended up back here.
I did. It's
great.
It's fortunate for me as well.
Yeah, well, we're happy that you're back. So, Dr. Kelso, let's talk more about orthopedic specialists. Now, I know you have several offices, and they're located in various areas. So, tell me how that came about.
Well, we would love to be able to just have one main office
Sure.
here in Brunswick County, but unfortunately, Brunswick County is a large geographic area. It's the biggest county in North Carolina, and it's just big enough that we felt like it's better if we had satellite offices in different areas so that it would be more convenient for patients to be able to access our orthopedic services in multiple different areas. And so we have 4 office locations. One is in Sunset Beach, one in the Leland area, Southport, and then the other one is in Supply. And by putting offices in those 4 areas, we feel like we can make it convenient for all people in the county to reach our services.
Yeah, I would agree. I think that by targeting those areas, you make it more convenient for pretty much anyone in Brunswick County to get to one of your offices.
And that's our goal, to make
Sure.
it easy for the patients.
Right, absolutely. Who are your other providers in the practice?
Well, there are 5 guys in our group. Myself, 4 of us are orthopedic surgeons, Mike Marushak, Eric Lesko, and Mark Foster. And then we have a pain management specialist, Dr. David Zub. And Eric, or Dr. Lesko, and Dr. Marushak, and myself specialize in basically adult reconstruction. Dr. Marushak, and we all have a background in sports medicine. Dr. Marushak has done a fellowship in sports medicine.
Right.
And then Dr. Foster specializes in spine and foot and ankle. And then with David is, of course, David Zub is our pain management specialist. So we feel like we have a lot of the specialty areas. My personal areas that I enjoy is adult reconstruction, and by that I mean hip replacement, knee replacement, and shoulder replacement, and I do work in all 3 of those.
I wondered what services you might provide in your office. What kind of procedures would you do in your office as opposed to a hospital?
Really, we don't have much in the way other than just seeing patients. I mean, in terms of procedures, we do various types of injections, joint injections, viscosupplementation injections for arthritis in the knees. But in terms of actual procedures like trigger fingers or carpal tunnel releases, minor surgical procedures, our offices are not really capable of doing that at this point. So we don't. Other than that, we take most of those services to the hospital.
Are there any specific kinds of procedures that you do in the office as opposed to the hospital?
Not really, June. Most of the procedures that we do are in the hospital. The offices are where we see our new patients, our patients we're getting ready.
And you have physical therapy too, right, in your office?
Not in the offices, but we're affiliated with physical therapy, and we work very closely with the physical therapy group so that patients, either before they have surgery or after they have surgery, are working with a group that have had a relationship for 7 or 8 years now, and we have a really close personal relationship with the therapist. And so if there's ever any kind of issue with a patient during their therapy, and the therapist wants to discuss it with the physician, they call us and we interact with them on a daily basis. So it's a good working relationship, but we don't do any kind of surgical procedures in the office.
Are you accepting new patients at this time, and are your other providers accepting new patients?
Yeah, we are always
accepting
new patients. Surgical practice always needs new patients because you cycle in and cycle out as we take care of you and you're healed from your problems and get better, and we have room for new people, and it's a ongoing process, not like a primary care or an internist that basically see the same people over and over again. We are always looking for new patients and very happy to take all comers. At any time you want to give us a call, it's great.
And how might they make those appointments?
I would say just call the office.
Call the main number.
Call the main number at the office. Talk to your primary care provider about getting a referral to see us. A lot of times that's not necessary. Just ask your primary care doctor to refer you if you need some sort of
specialist.
Orthopedic specialist is our name, and gosh, we would love to take care of all of Brunswick County.
Awesome. Well, it was a pleasure to have you back today. I can't wait to have you back again to talk about what else is new at Orthopedic Specialists. So I'm sure you'll be happy to come back and see us.
Anytime, June. Appreciate it.
Great. Thanks again.
Sure thing.
Thank you for tuning in to ATMC TV's HealthWatch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.coop. Please visit novanthealth.org for more information on Novant Health Brunswick Medical Center or local doctors and general health information. Thanks again for joining us today. Be sure to join us next time for HealthWatch on ATMC TV.
are ATMC TV, Channel 3, and HD Channel 910, your community channel.